Slack channel. And you can find that on the ASB Slack workspace. So it's in the same place where the posters are being discussed. We also invite you to join us after the presentations if you'd like to have some face-to-face discussion in the Qualis Lounge location 3 on spatial chat. So you can find a link to that also on Slack. So for all those who are speakers, please log in to the Slack channel after this session or throughout the day to check and see if there are any questions for you that remain to be answered. So one of the things that we will do that's been recommended from other sessions is we'll try to save the chat from this Zoom meeting and then transfer that over to Slack so that we can facilitate a smooth transition to the discussion. Okay. So with that, we'll start with our first speaker. So our first speaker is Emily McCain from North Carolina State University. And the title of her talk is Isolating the Energetic and Mechanical Consequences of Imposed Reductions in Ankle and Knee Motion During Gait. Take it away, Emily.
Thank you so much. So post-stroke induced muscle weakness is associated with metabolically expensive gait compensations. Specifically, weakness at the ankle limits push-off and therefore propulsion, while weakness of the knee can necessitate circumduction of the foot to enable advancement of the product limb. Therefore, post-stroke interventions often target the joint in an effort to reduce or eliminate the need for these expensive compensatory mechanisms. It's difficult to understand exactly what the independent role of ankle and knee function are on gait mechanics and metabolics, because ankle and knee motion is coupled, but also because isolating improved ankle or knee function in person post-strokes is difficult, if not impossible. So instead, we used a custom 3D printed ankle stay and DonJoy lockable knee braces to systematically limit ankle motion, knee motion, then ankle and knee motion simultaneously. We compared these 3 locked conditions to an unlocked condition where braces were worn but not locked. Using this study design, we were successful at reducing ankle range of motion as well as knee range of motion. So we turned our attention towards how our joint level restrictions had impacted limb level outcomes of circumduction and propulsion, as well as the whole body outcome of metabolic cost. We found that in any condition with ankle restriction, there was a reduction in ipsilateral peak propulsion. To investigate whether this reduction might be compensated for at the hip, we used time series joint powers to calculate the average positive hip powers in the sagittal plane, and found that whenever the knee was locked, there was a reduction in hip power when compared to the unlocked condition, as well as the locked ankle condition, indicating that restriction of the knee permitted sagittal plane hip compensation. It's possible that this knee restriction made foot clearance a priority, or that it limited the hip flexor's capacity to initiate passive knee flexion, thereby reducing motivation for in-plane compensations. We found whenever the knee was restriction that there was an increase in circumduction of the locked limb foot. Interestingly, this increase was relative to the locked ankle condition as opposed to the unlocked condition. It's possible that frontal plane motion was further reduced in the locked ankle condition due to the slight increases in sagittal plane hip power. We found that participants opted to hip hike or decrease their pelvic list during locked limb swing in order to enable this circumduction when the knee was locked. Our results emphasize the energetic impact of ankle restriction. Specifically, any restriction of the ankle was more expensive than the unlocked condition, and also simultaneous restriction of the ankle and knee was more expensive than restriction of the knee in isolation. Both of these results hint at the promise of ankle-based interventions. In post-stroke literature, energetic increases are often attributed to increased total average positive joint power. And we calculated this from time-varying joint power curves from both limbs and found that while metabolic cost tended to increase in the locked conditions, that average positive joint power tended to decrease. In fact, in the condition where the ankle and knee were simultaneously locked, we found that metabolic rate increased significantly, while total average positive joint power decreased significantly. This suggests that it's inappropriate to use total average positive joint power as a proxy for metabolic cost, at least in this research where we have restriction on joint range of motion. It's possible that this discrepancy is due to the inherent differences in mechanically induced joint restrictions when compared to post-stroke walking, which is impacted by unilateral muscle weakness as well as changes in motor control. In conclusion, this work was able to systematically limit ankle motion, knee motion, and simultaneously limit ankle and knee motion. And the gait that we saw when we did this had some similarities to post-stroke gait. Specifically, restriction of the ankle limited propulsion, while restriction of the knee increased circumduction of the foot accomplished through hip hiking. The energetic impacts of ankle restriction were substantial and support the promise of ankle-level interventions following a stroke. Overall, changes in total average positive joint power were a poor indicator of changes in net metabolic power. Therefore, net metabolic cost doesn't need to be driven by increased positive mechanical power. We think that future work could investigate whether other factors like muscle activation or effort may be more relevant to the mechanisms that are driving metabolic cost. Thank you so much for your time, and I look forward to questions.
Thank you, Emily. So the chat is open, so please go ahead and type in your questions and we'll take those up at the end of this block. And I would now like to welcome the next speaker, Nicole Rendos from Emory University, who will be speaking on real-time gait biofeedback enhances dynamic ankle stiffness and propulsion in healthy and post-stroke participants. Are you there, Nicole? Let's see. Nicole, can you unmute yourself?
Now I can unmute, but I am not able to share the screen. It says that disabled attendee screen sharing.
I think we'll have to maybe promote you to co-host. Maybe at the meantime, Natalie, would you mind speaking first while we figure this out? Natalie, are you there?
Yeah,
Natalie?
I can go next.
Great, thank you. So welcome, Natalie. Natalie is from the University of Southern California, and she'll be speaking about using visual guidance to acquire work from the treadmill during split belt walking does not accelerate adaptation.
Thank you so much, Julia. So as I guess everyone in this crowd really knows, the goal of assistive devices is to reduce the energetic cost of walking. And the success of these devices, which I have some examples here, depends not only on their design, but also on people's ability to learn how to use these devices. Therefore, we need to use adaptive processes to learn how to take advantage of mechanical work performed by the device. And accelerating these adaptive processes would lead to more effective intervention and more effective implementation of these assistive devices. In our previous work, we actually demonstrated that a split belt treadmill can also act like an assistive device. And that is because the difference in belt speeds allows the person to perform net negative work and gain work from the treadmill that allows them to reduce metabolic cost. So this can be achieved, as I'm showing here on the left, by bringing the leg on the fast belt further forward in front of the body. And so we observe that when people walk with what we call positive step length asymmetries, which are longer steps with this fast leg, they reduce the amount of work that the legs generate. And they also, we observed a reduction in metabolic cost that is greater than that traditionally reported. What is interesting about these findings, though, is the fact that these positive asymmetries have actually not been reported in the literature for split belt walking. We also recently showed, however, that when people are given prolonged time to adapt to a split belt treadmill, they will actually learn to step further forward with the leg on the fast belt. So in our protocol, we had people walk for 45 minutes at a split belt ratio of 3:1. And so first we see that the step lengths on each leg, so blue would be slow and red would be fast, they converge towards equal values around 15 minutes, which is what has been shown in the literature. But when we give an extra time of 30 extra minutes, these step lengths actually start to diverge again. So this is in agreement with this strategy that reduces the amount of work that the legs need to do. And this divergence in step lengths is actually accompanied by a continuous reduction in the work that the legs are generating. So based on these results, we argue that reducing energy cost may in fact drive split belt adaptation. So the question is then, if energy cost drives adaptation, can we accelerate adaptation if we instruct people to walk with a less energetically costly pattern? And that was our goal here. So we had people walk on a split belt treadmill for 5 minutes, and we provided them with visual feedback to guide those step lengths towards this more economical pattern. So they used visual feedback to take steps that were about 15% longer on the fast leg. And then we just turned off the feedback without stopping the treadmill. So we collected 8 participants and we measured leading limb foot placement, which is what we're going to use here for our equivalent of these longer step lengths on the fast leg. And then we also measured positive work by the leg on the fast belt. And so here I have some graphical hypotheses. So we hypothesized that with the guided feedback here in orange, people are actually going to step further forward. And this stepping further forward is going to be accompanied by a reduction in the positive work that the legs are generating. And so we compare both placement and work during this first minute of adaptation, right after we turned off the feedback, and at the end of the trial, so after 15 minutes. So for our results, we actually saw that participants increased foot placement. So here we can see in orange that with the guided feedback, they do bring their leg on the fast belt further forward. And this is significantly different from traditional adaptation, which I'm showing here in black. But when I turn the feedback off, you can see that they gradually move back towards where they would be if they were adapting normally. Similarly, actually with the guided feedback, we saw that that initial increase in positive work that we see during adaptation was reduced when we gave them that guided feedback. But when we turned the feedback off, and even after they have been using the feedback for a little bit, we did not see any differences between traditional adaptation and this guided adaptation in the amount of work that people are generating with their legs. So the take-home points are that guided feedback can be used to effectively instruct participants to adjust their gait pattern to use external assistance. However, participants do not retain coordination patterns that allow them to effectively take advantage of assistance. And we also conclude that short exposure with less energetically costly gaits is not enough to accelerate adaptation. And it might be the case that when we give them this less energetically costly gait initially during adaptation, it might be that energetics are not an important factor in shaping the locomotor pattern during these initial stages. And with that, I wanted to thank our team and our institutions.
All right, thank you, Natalia. So Nicole, let's see if we can get you back up here, great. So our next speaker is Nicole Rendos from Emory University. And the title of her talk is Real-Time Gait Biofeedback Enhances Dynamic Ankle Stiffness and Propulsion in Healthy and Pro-Stroke Participants.
Thanks, James. And this will actually bounce off of Emily's comment that discusses their need for ankle-specific gait interventions in stroke participants. So we know that individuals with stroke, it's the leading cause of long-term disability in adults in the United States, and they generate a decreased propulsive force generation, and that's seen by a decreased AGRF, decreased plantar flexor moment, and decreased power of the ankle. We have tried several gait interventions which targets these deficits, but we're going to focus on today is real-time gait biofeedback. And real-time gait biofeedback has previously shown improvements in gait variables such as that plantar flexor moment and trailing limb angle, but today we are going to discuss dynamic ankle stiffness, also known as quasi-ankle stiffness. So it's the relationship of joint position or joint angle and joint torque or joint moment. And it's measured of both active, so muscle component, and stress reflex components, and passive, the viscoelastic properties of the muscle, It's modulated in response to the mechanical demands of walking, such as change in walking speeds, added loads, change of ground slope, functional activities such as ascending and descending stairs, and uneven terrain. And it does contribute to propulsion. So today, we are going to evaluate contributions of dynamic ankle stiffness on biofeedback-induced increases in AGRF in able-bodied and post-stroke individuals. So this was our biofeedback paradigm. Here you can see a participant that will be walking, and you see the green target that he tries to reach, and that's 25% increase of AGRF above his baseline values. And as he reaches a target, you see the cursor move, and then for every successful step, you also hear an audible beep. So we had 9 stroke and 9 able-bodied participants. We lost a few participants due to data errors and extreme outliers. And we're going to discuss 2 specific points of data analysis. So our stance phase dependent variables between heel strike and toe off, which were that peak AGRF and the peak plantar flexor moment. And then we looked at specifically the second rocker. And the second rocker was defined as our peak plantar flexion to our peak dorsiflexion. And in that second rocker, we are looking at specifically stiffness, that plantar flexor moment, and then secondarily, our excursion or ankle range of motion variables. So during the stance phase, we're really asking, does the biofeedback work as intended? And here we do see an increase in that peak AGRF in both our stroke and our able-bodied participants. So they were able to use that biofeedback as intended. And we also saw increases in that peak plantar flexor moment in both groups. In that second rocker, our primary variable of interest was stiffness. So though due to small sample sizes, we did not see a true group by time interaction, we did look specifically at groups individually, and we saw that in the stroke participants, our quasi-ankle stiffness increased in response to biofeedback. And we did see in the second rocker, we did see a group by time interaction, but it was not shown in the groups split. And then for our ankle range of motion variables, which is also part of that stiffness calculation, we did see group by time interaction where our able-bodied participants decreased the amount of excursion and our stroke participants did not change their ankle range of motion, and it was achieved by not increasing or decreasing their peak dorsiflexion, but it was achieved by now decreasing the amount of peak plantar flexion they did have. So in conclusion, we know that biofeedback increases paretic ankle stiffness in stroke participants and that the strategies did change in response to the biofeedback. So our stroke participants, we did see an increased stiffness of the ankle and increased plantar flexor moment. However, in our able-bodied participants, they accomplished this goal by changing their excursion and changing the range of motion of the ankle. So in terms of our future directions, we really want to continue looking at the role of stiffness in post-stroke gait, comparing both the paretic and non-paretic limbs to able-bodied individuals, and then looking at other phases of the stance phase and how it relates to propulsion. And then we would like to thank the NIH for funding this research as well.
Thank you so much, Nicole. So we'd like to welcome now Jan Stenum, the last speaker for this block. Are you there, Jan?
I am, yes.
Excellent. Can you share your screen? Okay, so Jan Stenum is from Kennedy Krieger and Johns Hopkins. The title of his talk is Step Time Asymmetry, but not Step Length Asymmetry Optimizes Energy Costs of Split-Belt Treadmill Walking. Jan is on his phone, so you can see his screen, but you won't be able to see his face in real time. Okay, go ahead, Jan.
Yes, I'll start with a plug for the study here. If you want to read about it in more detail, you can find it published in the Journal of Physiology. The study here began with an interest in the relationships between gait asymmetry, energy cost, and energy optimization. You know that gait asymmetry is common in certain gait pathologies like post-stroke gait and amputee gait. And it's also true that these have an increased energy cost concurrent with their gait asymmetry. So asymmetry is often assumed to be detrimental in part because of these expected relationships between gait asymmetry and energy cost. The cost of asymmetry is nicely demonstrated in this study, wherein healthy participants were instructed to walk asymmetrically, and there's clearly a cost associated with the asymmetry. But an alternative view is that asymmetry could also be adopted if it is energetically optimal. And we wanted to test this idea using a split belt treadmill that has two belts that can run at different speeds. After an initial adaptation period, step lengths become symmetric or about symmetric, while step times become asymmetric. Asymmetry is here calculated as the ratio between the difference of the two steps divided by their sum. And we tested the hypothesis that the adapted steady state asymmetries in step times and step lengths were energetically optimal. We did that across 3 conditions that all had an average belt speed set to 1.25 meters per second, and with increasing speed differences set to 0.5, 1, and 1.5 meters per second. We recruited 10 healthy young participants that came into our lab on 3 separate days for each speed difference condition. They first walked symmetrically with belts tied at 1.25 meters per second, and then performed an adaptation period with belts split to find their preferred asymmetry. And last, they performed a series of cost mapping trials that were divided into first, cost mapping of step time asymmetry to find the optimal value, where step time asymmetry varied around the preferred value, while step length asymmetry was forced to be constant at symmetry. And next, cost mapping of step length asymmetry, again to find the optimal value, where step length asymmetry varied around symmetry, while step time asymmetry was enforced to be at the preferred value. In all of the trials, we enforced participants' stride time by the beat of a metronome set to their preferred value in tied belt walking, and we showed visual feedback of step time asymmetry and foot place difference in order to indirectly enforce step length asymmetry. Last, we expressed metabolic cost as the percentage of net metabolic power relative to its value in tied belt walking. When we look at the values of the preferred step time asymmetries, we find that those increase with greater speed differences between the belts. When we compare the preferred to the energetically optimal values of step time asymmetry derived from the cost mapping trials shown in panel B, we find that the preferred and optimal values were not statistically different, which supports the idea that humans will adopt an asymmetric gait to optimize energy cost. When we look at the preferred values of step length asymmetry, we find that those were not different across speed different conditions and that they were about symmetric. When we compared the preferred with the energetically optimal values, again derived off of the cost mapping trials showed in panel B, we find that the preferred and optimal values were statistically different, which suggests that the preferred values were not selected in order to optimize energy cost. I should say, though, that this does not rule out that step length asymmetry during the adaptation reduces cost, but it doesn't seem to be optimizing cost strictly. In all, we found that the preferred step time asymmetry in split belt treadmill walking was energetically optimal. That supports the idea that humans will adopt an asymmetric gait to optimize cost, and it may suggest that the asymmetry seen in pathological gait may be a functional adaptation undertaken in order to reduce energy cost. Of note is that we found that only temporal gait asymmetry was associated with energy optimization, while spatial asymmetry was not. And last, it is not clear how these results would generalize to gait pathologies, so we think that that might be a fruitful area for further research into the relationships between gait asymmetry and energy cost. Thank you.
Okay, so I'd like to thank all the speakers from our first block. So we'll go spend the next 8 minutes just addressing some of the questions from the chat. The first question is from Caitlin Banks, and it was directed to Emily. Do you think that your work has implications about whether people with stroke should wear rigid AFOs?
Yes, I do think so. I also think that it's a kind of a cost function where you're trying to optimize what's best for an individual. So somebody who has such extensive muscle weakness that their plantar flexion may not be limited significantly by wearing a rigid AFO, it might be better to avoid foot drop using it. Whereas if you have somebody who has a higher functionality and you know that with that rigid AFO, you're restricting push-off power and therefore propulsion and likely increasing metabolic cost, then I think it could have an impact as well.
Okay, there's another question for you, Emily, from Mohammed Shariji. So while joint power is purely mechanical, metabolic cost highly depends on the level of co-contraction of muscles banding a joint. Have you looked at EMGs to look at co-contraction?
So this is actually part of a larger data collection, which did include EMG, and we're in the process of processing that EMG. Co-contraction is one of the metrics that we've considered calculating, as well as some kind of whole body metabolic cost approximation. So we have considered it. We haven't got it on a graph yet.
Thank you.
So I think what we'll do is we'll just maybe ask a couple questions of each speaker, since we have lots of questions here. Natalia, this is one from Luke Negro, which I think is an interesting question. What sort of training paradigm do you think would help device users retain better patterns for longer?
That's a really hard question. Yeah, I think, well, for one, I think what we need to consider is that it might take people longer to learn how to effectively use these systems than we usually train them. So the fact that we do see some reductions during short exposures does not necessarily mean that they have learned how to effectively use it or use it to like the best of its capacity. So I would say that, kind of to answer that question without actually answering your question, I would say that the time component needs to be considered to be longer than we usually do.
Okay, another question for you, Natalia, is do you have any guess of what people might be optimizing instead? Comfort, stability, maybe? This question is from Anne Elizabeth Martin.
Yeah, if I had a penny for every time people ask this question, I would be a very rich person. We don't know. We don't know if they're just optimizing one thing. We don't know if it's a hierarchy. Our experimental approaches can only kind of be designed to answer one of these at a time. It also might be that at different time points during the adaptation process, people are optimizing different things. So initially, particularly because our participants were all naive to a split belt treadmill, it might be that that first couple of minutes of exposure just challenges their balance significantly. And so their first goal might be not falling. Then later on, it might be that they start to optimize energetic cost just because they're gonna be there for a while and they kind of explore the environment in a way that allows them to do this process once they have accomplished like the big goal of staying upright and continue to walk on the treadmill.
Question for Nicole. Did you notice any characteristics? So this is from Margot Donlin. Did you notice any characteristics that were consistently present in the stroke participants that responded to biofeedback?
So interestingly, we actually saw that all of our stroke participants responded to the biofeedback. We set the biofeedback at 25% above their baseline AGRF, and every single one of those participants were able to at least meet or exceed the goal during that minute trial. So unfortunately, we're unable to look at specific characteristics because we did have a very wide variability in those stroke subjects, but everybody was able to meet those goals.
Okay, Jason France has a question for Nicole. Is ankle joint quasi-stiffness lower in persons following stroke? And is that a prerequisite for this work being related to clinical countermeasures for that population?
Yeah, so we are actually doing this as a separate analysis and a larger sample size because there is very conflicting evidence based on if the paretic versus a non-paretic limb is stiffer. And it also depends on which portions of the stance phase you do pick out. So we did see in our separate analysis with a larger sample size, the paretic limb does have a decreased ankle stiffness compared to the non-paretic limb, and it's also lower than able-bodied individuals. And then we need to really look at some other clinical measures. We have compared it to things like the Berg Balance Scale, the Fugel-Meyer Scale, as a separate side analysis on those 15 individuals, and we have yet to see any clinical measures that do relate to ankle stiffness. So it's a question we have just started to explore, and I think there's a lot more work that needs to be done to really get to some of those mechanisms.
Okay, thank you.
I have a question for Jan. This is from Dan Sirit. Do you think that the unique pattern of mechanical work provided by the split belt treadmill may impact your results? How would these results compare to asymmetries in overground walking? So the question seems to be about the generalizability of ideas that asymmetries could be optimal.
Yeah. Well, I think to the first part of that question, if you were to look at the cost mapping data for step length asymmetry, I think those actually nicely show that idea where you appear to be able to take more advantage of this work with greater speed differences. So that is what these cost landscapes look like. It becomes progressively more flat with positive values of asymmetry. In terms of the generalizability, another part of this project here included overground, or not overground, but normal treadmill walking and different asymmetries there. We found that the most dominant factor was step time asymmetry, although there's also a cost of step length asymmetry. That appears to be, from our data, a more dominant factor.
Okay, and I think this will be the last question before we move on to the next block. And this question is actually for Jan and Natalia from Jamie Roper. Can you just comment on how holding onto the treadmill during split belt walking, especially during the initial perturbation, might influence the results?
As far in the study we did, we asked participants as well as they could not to hold on. Some did. I would think for these longer adaptations, I don't mean to speak for you, Natalia, but maybe you should just go ahead and take it yourself.
That's okay. I answered in the chat, but yeah, our participants actually did not hold on to a treadmill because of our mechanical work calculations. When they hold on to the handrail, we cannot account for that force. But I think, yeah, James has some work showing that it doesn't seem to affect the timeline of adaptation. Correct me if I'm wrong.
So essentially, if you're holding on early on, you have a smaller initial perturbation, but in all of our work, people let go later on and they tend to get to the same point. All right, so I think with that, we will go to our next set of speakers. So Julia and Claire will take it from here.
All right, so thanks again. So the next speaker is Rebecca Krupenevich from NC State. The title of her talk is The Effects of Age and Locomotor Demand on Mechanics During Walking.
Okay. Screen is frozen. There we go. Older adults walk slower and with a higher metabolic cost than young adults. These functional impairments are associated with a loss of independence and quality of life and are thought to stem in part from a substantial reduction in mechanical power during the push-off phase of walking. Age-related reductions in push-off intensity are often attributed to deficits in power output from the plantar flexor muscles, as shown in this figure by Franz and Crum, with older adults displaying smaller ankle contributions to trailing leg work compared to young. However, interventions designed to strengthen the plantar flexors are generally unsuccessful at improving push-off power, which may suggest that the plantar flexors are not the only contributing factor to reduced push-off power during walking. Recently, the foot has been getting more attention for its role in governing push-off power. The structures of the foot are uniquely suited to function as both a stiff lever for push-off and an elastic energy storage and return system for economical locomotion. As we can see in this figure from Riddick et al., the foot arch, which is representative here of the foot muscle tendon unit, and the MTP joints exhibit moment waveforms that are generally similar to that of the ankle joint during level stepping, stepping up, and stepping down, particularly in late stance. which suggests a similar propulsive function during the push-off phase of walking. Unfortunately, the majority of studies that compare gait biomechanics between young and older adults model the foot as a rigid segment, which may neglect potential age-related changes in mechanical contributions from the foot. This is particularly important because we know that aging is associated with changes in the structural properties of elastic tissues spanning the foot and ankle joint, which may act to disrupt the mechanical behavior of the foot. But the effective age on foot mechanics during walking is relatively unknown. Therefore, the purpose of this study was to determine whether young and older adults exhibit differences in foot mechanical work during walking. Consistent with evidence of age-related changes in foot structure and function, we first hypothesized that older adults would exhibit less positive and more net negative foot mechanical work. We also hypothesized that due to the speed-dependent nature of foot kinematics, the effective age would increase with locomotor demands. To test this, we had 9 young and 10 older adults walk barefoot on an instrumented treadmill at 3 speeds. We also varied locomotor demand by asking subjects to walk at 1.2 meters per second while wearing a waist belt that was connected to a motor that provided a constant aiding or impeding horizontal pulling force equal to 5% body weight. You can think of the aiding force condition as functionally similar to decelerating or downhill walking, and the impeding force condition as functionally similar to accelerating or uphill walking. We then estimated footwork using a unified deformable foot model that was characterized by Takahashi et al., which captures the deformation behavior of the foot as it interacts with the ground. Here we see positive and negative footwork across each of our 3 speeds. Starting with positive work in the top left corner, older adults in blue generated less positive footwork compared to young adults in black at the slowest and fastest speeds, and more net negative footwork across all speeds. On the bottom, we have positive and negative footwork during aiding, normal, and impeding walking. Older adults generated less positive footwork during the aiding and impeding force conditions, and more net negative footwork in the normal walking and impeding force conditions. To summarize, we found that on average, older adults generated less positive and more net negative footwork compared to young adults. We also found that in general, as locomotion demand increased, the effective age increased, as indicated by the dashed blue and black lines showing the interaction across speed and task demand. Our results suggest that during walking, age-related differences in foot mechanics may contribute to reduced push-off intensity via greater energy loss from distal foot structures, and that this may be further exaggerated during walking tasks with a greater demand for power generation, such as walking faster or walking uphill. We think that older adults have a reduced ability to actively regulate foot mechanical stiffness, which may ultimately contribute to the misappropriation of ankle power output and reduced push-off intensity in older adults. These preliminary findings may serve as a roadmap for developing future low-cost mobility interventions. I'd like to quickly acknowledge our funding sources and our collaborators at the University of Nebraska-Omaha and UNC Health, and I'm looking forward to your questions.
Great, thank you. Next up, our next speaker is Anahid Ebrahimi from the University of Wisconsin-Madison, and they'll be talking on the shear wave speed to assess tendon loading in children with cerebral palsy.
Thank you so much. So I'm a postdoc fellow in the Neuromuscular Biomechanics Lab led by Dr. Daryl Thielen, and today I'll be sharing some work we've done in collaboration with Gillette Children's Specialty Healthcare. This work was funded by the NIH. So children with cerebral palsy, or CP, often exhibit contractures, spasticity, and impairments in selective motor control. This collectively contributes to inappropriately timed and modulated muscle forces during walking, which results in severe gait disorders and can make daily activities challenging and overly exhausting. So assessing a child with CP for treatment requires a team approach from surgeons, biomechanists, and physical therapists. Patients will often receive medical images, a physical exam, and a gait analysis if resources are available. And then based on this sort of collective assessment, surgical interventions will often be suggested at the muscle tendon level. So for example, lengthening the muscle tendon unit or performing a tendon transfer or an orthopedic procedure. Okay, but there's a really big asterisk in conventional gait analysis, which is often used in clinical treatment. and that is that we cannot use joint moments to necessarily inform individual muscle tendon forces. So for example, looking at the knee joint moment here, the patient's data is in green, and it looks fairly close to a typically developing cohort, which is that gray band. But in fact, when we look at the EMG, we see high levels of co-contraction about the joint. So we're missing this direct quantification of individual muscle tendon forces, which can be particularly important in pathological gait where co-contraction can be a major factor. Recently, patented shear wave tensiometers have been developed to measure shear wave speed over superficial tendons. So the tensiometers tap on the tendon and the wave is picked up by miniature accelerometers in an array. And then using a tension beam model, tendon force is directly dependent on shear wave speed. So we had our participants do several overground walking trials while we collected motion, force, and muscle activity data, along with this new Achilles and patellar tendon shear wave speed. We tested the hypothesis that tendon shear wave patterns would be distinct from joint torques. So I'll first share the results using representative data from a typically developing participant, a child with CP walking in crouch, which is in baby blue, and a child walking with a stiff knee gait, which is in purple. So we can see that the torque curves for the ankle and knee are representative of these different gait patterns. Then looking at the wave speed versus torque in those bottom plots, we found a high correlation between Achilles tendon wave speed and ankle torque in our controls and our cases, despite heterogeneous torque patterns. And then when we look at the patellar tendon, there was significantly less and more variable correlation between patellar tendon wave speed and knee torque, pretty much across participants. So the wave speed in dashed lines kind of help illustrate this point further. So the Achilles wave speed modulated fairly similarly to the ankle torque in all participants, while the patellar wave speed varied fairly similarly for this control. The cases showed a more heterogeneous response. So in individual trials, we did see periods of high patellar tendon wave speed and low knee torque, which can arise from co-contraction of the knee extensors and flexors. On average, across all our subjects, we found a lower correlation at the patella around 0.7 compared to the ankle at 0.97. And so overall, the purpose of this study was to determine the unique information gained from shear wave tensiometry over conventional gait metrics like joint torque. So in summary, this study showed that Achilles tendon wave speeds can capture the net ankle loading seen in pathological gait. And in particular, patellar tendon wave speeds tracked periods of both knee extensor loading and may also capture periods of co-contraction. So we're encouraged by these results that shear wave tensiometry can be used to help guide treatments of gait disorders in CP. In long term, we can envision tensiometry being integrated at each step of the treatment planning process from pre-op to post-op. Tensiometry could also be extended for use in physical exams, for example, spasticity assessments, or in the operating room to set muscle tendon tension objectively during multi-level surgery. And our ongoing testing is evaluating whether these results extend to more severe gait disorders, such as with increasing severity of crouch gait, and to evaluate how tensiometry can be used to evaluate specific treatments. Thank you so much for your time, and I look forward to your questions at the end.
Thank you so much, Anna. I'd like to welcome the next speaker, Barry McLean from the University of Florida. She's going to be presenting the work of Skyler Levine et al. And the title of the talk is The Effects of Ankle Weight During Overground Walking Using a Body Weight Support System.
Hi, I'm Barry McLean, and you've already heard what I'm going to be talking about, so let's just dive right into it. Body weight supported walking is a technique used in gait rehabilitation to help those who have difficulty walking practice walking. And most often what happens is a harness is used to provide an upwards force that reduces the effective body weight and reduces ground reaction forces on the legs, making it easier to walk. Most historically, this was done with treadmills, but there's been a more recent move towards overground walking because overground walking allows the patient to choose their own walking speed, to practice walking around corners or over obstacles, and is in general a more realistic rehabilitation environment. If a patient still struggles to walk with body weight support, physical therapists can provide assistance by physically moving the legs. Alternatively, an exoskeleton can be used to physically move the legs. Now we know that in normal conditions, when you wear an exoskeleton, you add mass to the legs. And we know that adding mass to the legs changes our gait dynamics. What we don't know is how adding mass to the legs in low gravity changes our gait dynamics. And that's the purpose of this study. For this talk, I'm just going to talk about one parameter, and that parameter is the plantar flexor push-off power just at the end of stance. So this is called the push-off power. And there's been a little bit of a debate in the biomechanics community about the purpose of this push-off power. So one school of thought is that this plantar flexion power is to accelerate the trailing limb from stance into swing phase. And the other school of thought is that it is used to redirect the center of mass up and over the leading limb. So we designed an experiment in walking overground with body weight support without and with ankle weights. And our thinking here was that if the plantar flexor power contributes substantially to accelerating that trailing limb into swing phase, then when we add ankle weights, there should be an increase in plantar flexor power regardless of the amount of body weight support provided. So our experimental setup used a body weight support system that we built, motion capture and force plates that we didn't build, we just bought them, and a timing gate to control for speed, so we were walking at 1.2 meters per second. This is a video of someone walking, and you can see the ankle weights on the feet, and this is at about 0.75 gravity. So onto the results. On the x-axis here is right heel strike to right heel strike, so an entire gait cycle. And on the y-axis is that ankle plantar flexor power. So shown in blue right now is normal walking, so normal gravity without the ankle weight. The dashed line shows what happens when you add ankle weight. So there's a small increase in that peak plantar flexor push-off power when you add the ankle weights. Now in purple is 0.3 gravity, so roughly 70% of the body weight supported. And there is a huge decrease in that ankle plantar flexor push-off power. When you add ankle weights, there's actually a pretty large increase in plantar flexor power at low gravity. So what we wanted to say was that the ankle plantar flexor power at the end of stance contributes substantially to accelerating the trailing limb into swing, but it also must contribute to supporting the center of mass because we saw that decrease between normal gravity and low gravity. We also have a lot of data on EMG that shows that muscle activity doesn't necessarily change intuitively with different levels of gravity when you add ankle weights. So the implications for these findings are for a design of a robotic exoskeleton to assist in overground body weight supported walking. So when we add mass, it's useful to know how that will change our gait biomechanics, and that can be considered when using these devices. Also, it would be really useful for consideration of mass distribution on astronaut apparel for extravehicular expeditions on Mars, and how adding the mass at different points of the spacesuit will affect how we walk. So I'd like to say thank you to everyone in the lab, our lab managers, Seth and Nicole, and to 2 extra undergraduate assistants who help with this work, Han Nguyen and Angel Bu. And thank you all for your time.
All right, I'd like to welcome our last speaker for this session, which is Christopher Hurt from the University of Alabama at Birmingham. He'll be talking about split belt walking against resistance, increases walking propulsion asymmetrically. Thanks.
All right, thank you for allowing me to speak about some research we've conducted in my lab. I first would like to acknowledge my co-authors and my funding source. So I'm going to start with what I hope is a provocative question. During treadmill walking, can we differentially target a limb or joint to increase the specific amount of work it performs? So let's see what we end up with. So progression of walking requires that work is performed to support the body against gravity and propel forward. Now those walking requirements, those walking requirements can increase with speed as depicted in the top panel in a study my graduate student Dan Kuhlman performed that we published last year. And requirements can also increase with treadmill slope as depicted in the figure at the bottom in a study from Franz et al. In 2008. Now, in order to meet the demands, the work may be shared differently amongst the joints of the lower extremity. And in fact, the nervous system of most individuals can flexibly alter the performance of joint work relative to task demands. However, it's unknown how the nervous system modifies motor output in a situation where speed and slope are altered simultaneously. So for this study, we wanted to assess the ability of matching split belt treadmill walking with increasing impeding forces, in this case hill walking, in young healthy individuals to assess the ability to specifically target increased force output at a given limb or joint. We recruited 13 healthy young adults to participate in this study. And we performed kinetic and kinematic analysis while participants walked on an instrumented dual belt treadmill. Individuals were instructed to avoid using the handrails for the whole time that they were on the treadmill. Along the bottom is the schematic of our methods. We had individuals walking at 0.5 and 1 meter per second. Individuals walked at a tied condition at 0.5, tied condition 1 meter per second, a split belt condition, and then we allowed for a washout. We repeated this at 2 different slopes at 5 and 10 degrees. For our data analysis, we looked at several different levels of data, starting with the ground reaction force, specifically the propulsive impulse. We then looked at total positive joint work, and finally we looked at individual joint work of the lower, individual positive joint work of the lower extremities, all using repeated measures ANOVA. Okay, so for the ground reaction force, what we saw is that propulsive impulse of the slow limb increased more than the fast limb. So what we see here is the blue is the limb that's on the slow belt, and the red is the limb that's on the fast belt. And at 0 degrees, what you would expect is that the fast belt generated a larger propulsive impulse, but as we added slope, there was a significant interaction. We also saw a significant interaction in the percent time spent in propulsion as well, okay? However, when we looked at total positive limb work, we saw that total positive limb work was higher on the faster treadmill belt across all walking slopes. The interaction was not significant. So again, it was higher throughout all the different slope conditions. So this pattern did not follow the ground reaction force impulse. So when we look at it at the individual joint level, okay, so we're looking at positive work at the individual joint level, we saw a significant interaction between speed and slope for all lower extremity joints. And when we look at the hip and the ankle, we saw that the fast limb increased to a greater degree than the slow limb across all slopes. Whereas when we look at the knee, we saw that the slow limb actually increased to a greater degree than the fast limb at the slopes. Okay. And when we look at a percent positive work of the lower extremity, we can see that it varies by joint and by condition. So on the y-axis here, we have percent positive work for the fast and the slow limb, for the ankle, knee, and hip. If we break them out and look at them individually, we see that with increasing slope, the knee of the limb on the slow belt accounts for more positive joint work. So overall at the 0 degrees, we saw a lot of hip work being done in the split belt condition, but as we added slope, we saw an increase in the knee positive work that was being performed. And when we look at the fast belt, okay, the limb on the fast belt, overall we saw that the hip performed a similar amount of relative work, and we saw generally a decrease in ankle positive work by about 10%, or decrease, sorry, in ankle positive work by about 10%, and an increase in knee work by about 10%. So, can we combine walking conditions and target a limb, or more specifically, individual joint work? Yes, we can. Okay. So, as far as the potential clinical relevance, by incorporating a split belt treadmill with increased parallel forces, so a slope, or using similar to what we've done in the past with backward directed resistive forces, and I know that Franz and his team have done that as well. Researchers can target particular limbs and or joints to target increased work. However, depending on the level of data you're interested in or the purpose of training, you may modify which limb is on which belt. And this has possible impact on training for individuals post-stroke or those with specific orthopedic issues like ACL injuries. Thank you.
Thank you so much, Daniel, and all the speakers of this block. So we have a couple of minutes to take up a few questions. We'll try to rotate one question per speaker, and we'll start with Rebecca. This is a question from Elena Gabrowski. Do you think that footwear has any effect on the age-related changes in foot mechanics?
It certainly can. So the data that I presented today, these participants were barefoot, but there is research out there showing that different shoe stiffnesses or even orthotics, so different stiffness orthotics in the shoes can make a difference in the amount of energy lost by the foot during walking, which would make a difference to total energy loss of the limb.
For the next question, this is from Jocelyn Heffer to Anna. This question actually got upvoted a couple of times. Can tensiometry differentiate between differences in tendon stiffness due to heightened EMG as opposed to contracture?
Thanks so much for the question. So I'm not entirely sure at this point, but because both heightened EMG and contracture would show an increase in force. But the good news is that we have pretty comprehensive data sets for our subjects. So we have physical assessments, EMG, kinematics, kinetics, the whole bit. So hopefully, I will definitely look into that. I think that's something definitely worth looking into. And collectively, I think with the physical assessments, we can piece that out maybe. Thanks.
Thanks, Anna. Next, we have a question for Vari. And hold on, I lost it. Okay, this is from Luke Negro. Very clever way of parsing out the forward/vertical components of the ankle moment. Have you looked at changes in ankle dynamic stiffness in these data? That ankles change as well?
So I really like that you asked about ankle stiffness because I have a poster that is on ankle, knee, and hip dynamic stiffness with gravity. So at normal, across gravity, the ankle stiffness does decrease as you reduce gravity, but we haven't looked at how the ankle quasi-stiffness changed with the ankle weights, and that is definitely something that I would like to do. The second part of that question is the ankle angles kind of change, but really nothing significant. I have that data if you would like to look at it. Thanks.
Great. And this question is for Christopher from James Finley. How long were participants allowed to adapt to the split belt condition? Do you think that the time allowed for adaptation would change the distribution symmetry of the joint and limb work?
Yeah, that's a great question. We actually had a fairly short time that individuals adapted. So it was really about, I think, 2 minutes, which is really short. But we did look at 60 steps of individuals. And in the last 20 steps, the performance that we see on an initial analysis had plateaued. And so we feel, and we've seen this happen on multiple occasions, because we've had some other work that we're doing with split belt treadmill walking, and individuals adapt really quickly. Now, I think what James will be talking about, and I see it in his data as well, there's kind of this quick, fast adaptation, and then there's kind of maybe a slow adaptation. And so that would be an interesting thing to look at in a longer term situation because, you know, we don't have the 45 minutes of data that you looked at. Great question.
All right, great. So we're gonna pass, just as a reminder, we're gonna post all of these onto the Slack. channel afterwards. So I know that we've got lots more questions popping around, but we'll have opportunity to, I hope you guys will join us afterwards for that. So moving on to our last, but certainly not least block, we'll start with Scott Ulrich from Stanford University. And they will be discussing muscle coordination retraining reduces knee contact force during gait.
Okay. Well, thank you for the introduction. Today I'm excited to share with you the work of my colleagues at Stanford, Rachel Jackson, AJ Seth, Julie Colasar, and Scott Delp, in developing a muscle coordination retraining strategy to reduce knee contact force. So reducing the compressive loading in the knee is the target of many non-surgical interventions for knee osteoarthritis. Knee contact force reaches several body weights during walking. And about one body weight of that force we call the intersegmental force, or the resultant from inverse dynamics. But about 50 to 75% of knee contact force is primarily contributed by muscles. Kinematic gait modifications, like changing the foot angle, serve to shift the intersegmental force from the medial to the lateral side of the knee. But relatively few gait modifications target the large muscle contribution to knee contact force. Previous simulation studies have suggested that if we could walk without activating our gastrocnemius, we could reduce the second peak of knee contact force. But this hypothesis has not been tested experimentally. Today, I'll show you how we taught individuals to walk with a gastrocnemius avoidance coordination pattern. And first, we used a musculoskeletal simulation to develop our biofeedback system. We then tested the biofeedback experimentally, and finally used the simulation to estimate the effect of the intervention on knee contact force. To design the biofeedback, we first wanted to know what muscle compensations would be necessary to walk without activating the gastrocnemius. So we ran two static optimization simulations with identical kinematics but varied coordination patterns. The natural coordination pattern in the solid line minimized the sum of squared muscle activations, while the gastroc avoidance case had an additional penalty for gastroc activation. And as has been previously found, we did see a reduction in the second peak of knee contact force. At the muscular level, we saw the expected reduction in gastroc force, and to compensate to generate the ankle plantar flexion moment, soleus force went up. And to compensate at the knee, we saw an increase in hamstrings force. But you'll notice that the increase in hamstring force is less than the reduction of gastroc force, which is because the hamstrings have a larger knee flexion moment arm than the gastroc, so they can generate that same moment using less force, which is why with fixed kinematics, this approach works. We then used those results to design biofeedback for our experiment. We knew we wanted people to reduce gastrocnemius activation, but retain a normal ankle plantar flexion moment, which would mean we'd also need to teach them to increase soleus activation. So in the experiment, we asked if humans can change the relative activation of redundant muscles like the gastroc and soleus during a complex task like walking. 10 healthy individuals walked on our instrumented treadmill while we processed EMG from their gastrocnemius and soleus in real time. They first performed a baseline walking trial where we measured their gastroc to soleus activation ratio, shown in the bottom right, as they walked naturally. We then provided them with 3 trials of visual biofeedback where their goal was to reduce their activation ratio, shown by the bar magnitude, as well as reduce their gastroc activation, shown by the bar color. So the goal was a small blue bar, which would indicate they reduced their ratio primarily by reducing gastroc activation. And finally, they performed a 6-minute retention trial to see if they could remember the new coordination pattern without feedback. So after the 3rd feedback trial, individuals reduced their activation ratio by an average of 24%. Which was primarily driven by a 17% reduction in gastroc activation. And the same trends held true during the retention trial with no feedback. So we then moved back to simulation to answer the question if the resulting gait pattern reduced the second peak of knee contact force. We simulated the experimental data using EMG-constrained static optimization with a cost function that minimized the sum of activations squared and a constraint that made sure that the activation ratio in the simulation matched what we measured from EMG. And we saw a 12% reduction in the second peak of knee contact force, which is similar to the effect of losing between 16 and 38% of body weight for these subjects. In conclusion, we found that humans can change the relative coordination of redundant muscles if we give them simple biofeedback. We found that a gastrocnemius avoidance gait pattern can reduce knee contact force and could be a promising intervention for knee osteoarthritis. And more generally, this study shows the utility of using simulation to design biofeedback that could help people learn more favorable movement patterns. So with that, I'd like to thank the Stanford Neuromuscular Biomechanics Lab. Thank you for listening, and I look forward to further discussion.
All right, thank you, Scott. So our next speaker is Dan Surratt from ECU, and the title of his talk is Peak Knee Joint Forces During Asymmetric Split Belt Treadmill Walking, a Preliminary Study.
All right, can everyone hear me? See my slides?
Yes.
All right, perfect. So I would like to go over some work that we did at the Applied Movement Performance Lab at Virginia Commonwealth University, of which I'm a PhD student. And I'd like to go ahead and just thank my collaborators, Dr. Carrie Peterson and Dr. Benjamin Darter, right at the start. So as we've kind of talked about already throughout the course of this particular session, symmetry may be an inherent characteristic of human gait, but asymmetry may be present in certain pathologies such as those with stroke, lower limb amputation, or those with spinal cord injury. Asymmetry is more than just an aesthetic concern because it may alter measures of gait performance. And there's some limited data in the literature that suggests that asymmetry itself may also alter knee joint contact forces between limbs. However, the exact connection has not been fully described. This is important because an alteration in force through the knee joints may also alter the risk of osteoarthritis development in these particular joints. And this is especially relevant for those clinical populations. For example, those with lower limb amputation tend to have a higher risk of osteoarthritis in one leg, and they typically walk asymmetrically. So there is a lot of theoretical evidence that suggests asymmetry may alter the risk of osteoarthritis. So we wanted to connect the dots between provoked gait asymmetry on peak knee joint contact forces. And so our preliminary work was in healthy individuals that we provoked gait asymmetry through the use of a split belt treadmill paradigm. And this has already been discussed in this session quite a bit, but I want to draw your attention to the comparison in step lengths between the baseline and post-adaptation conditions. So with unimpaired individuals walking on a treadmill with both belts going the same speed, they will most likely demonstrate equal step lengths between limbs. As they go through that split belt adaptation with one belt moving faster than the other, step lengths will respond and adapt. And then during the post-adaptation condition, where both belts are returned to the same speed, you'll see a robust reverse asymmetry that's fleeting in time, but is predictable and something that we can count on. So we wanted to use the comparison between baseline and post-adaptation because both demonstrate individuals walking with both belts going the same speed, which is comparable to overground walking, but also demonstrates a distinct difference between symmetry and asymmetry. So in order to do so, we had 20 young, healthy subjects undergo the split belt treadmill paradigm. They adapted for 15 minutes and we captured data during a baseline walking trial, as well as the first few seconds of the post-adaptation condition. We calculated step lengths using Visual 3D, and I want to just kind of delineate limb A as being the limb that's longer step length during post-adaptation condition, the limb that was assigned to the fast belt, and limb B is the one that's a shorter step length during post-adaptation condition, the one that was assigned to the slow belt. But that nomenclature will kind of help a little bit later on. So as you can see from the table to the right, both limb A and limb B had similar step lengths, and they diverged exactly as we'd expected during the post-adaptation condition. We also examined peak axial knee joint contact forces in both limbs using OpenSim and the Gait 2392 model. We used the contained joint force analysis tool. And from the raw data here, you see similar values for the baseline peak force and body weights that then diverged during the post-adaptation condition. What we really wanted to do is examine the symmetry of these two values. So we created a symmetry index for both the step length symmetry and the peak force symmetry using a ratio of the differences equation. So 0 indicating perfect symmetry going towards -1, or 1 indicating asymmetry in opposite directions. So for step length symmetry, a positive is going to indicate a longer step length on limb A. For peak force symmetry, a positive is going to indicate a higher peak force on limb A. What you see during the baseline condition is both values for peak force symmetry and step length symmetry were right around 0, indicating symmetry of both values. During the post-adaptation condition, you see a asymmetry of both values with the higher peak force on limb B and a higher step length on limb A. So sorry if that didn't get changed quite a second, so I'll let you linger on that slide for just a second. We also correlated the values together using a Pearson's product correlation. So we found that there was a significant correlation between the two with an R value of negative 0.71. And this graph shows the overall correlation as well as both the baseline and the post-adaptation condition. So you see the black line is the R value of negative 0.71. Going to the right on the x-axis indicates a longer step length on limb A, and going down to the negative values on the y-axis is a higher peak force on limb B. So we saw that a relatively short step length was associated with a relatively higher peak knee joint force. So what we concluded from this study is that indeed an asymmetry in step length was associated with an asymmetry in peak knee joint contact forces. And specifically, when an asymmetry was present, the limb that takes a shorter step length demonstrates an elevated force. And this comports with what we see in the literature because, for example, those who've had lower limb amputation do demonstrate an increased risk of osteoarthritis on the intact limb knee, which is a limb that typically takes a shorter step compared to the residual limb. So we suggest that asymmetry itself may be a driver of the alterations in knee joint contact forces, and those rehabilitation techniques that intend to mitigate the risk of osteoarthritis may also want to address asymmetries as well. In future directions, we want to actually have individuals with clinical populations, such as those with lower limb amputation, go through this paradigm and examine the differences in peak forces as they will be walking asymmetrically to begin with, and during that post-adaptation condition, if we assign the belts correctly, we'll get an increase in symmetry afterwards. So I thank you and I thank my collaborators for this, and I'd be happy to answer any questions after this block is over.
Wonderful, thank you. Next up, we have Paul DeVita from East Carolina University. He'll be discussing surface stiffness affects knee joint kinetics during decline, but not level running.
Paul, I think we can't hear you.
Yeah, I was going to say this.
Let's see. We can see your video perfectly fine on your slides, but we can't hear you.
Can you try to mute and unmute? Do you have a headset? Shoot.
One other thing you may want to check if you push the arrow by the mute button is to see what which microphone you're using. Oh, I think it's an internet connection.
I am unmuted.
Oh, perfect. There we go. We got you.
I will jump in somewhere. My apologies. Somewhere. I can't quite get the bottom of the screen. This is a good presentation. So when you run downhill, there are very large loads on us, both externally and in our patellofemoral joints, for example. And this is decline running and incline running, yes, decline and incline and level running. And as you can see, there are large loads in decline running. Sorry.
At the top left of the screen, that little, there's a presenter, like all the way top left.
Right, I never use that button.
Up, a bit to the right, there you go.
Thank you.
No problem.
So we measure decline running in our lab in this manner. And in this case, we're changing surface stiffness by putting this large mat all the way along the runway. And we run with and without the mat. And in this bottom condition, you can see here, this is level running. And we have the mat all the way along the runway, and we run with and without the mat. And what we are doing really is manipulating surface stiffness by using this mat. And we hypothesized today that running on a more compliant versus stiffer surface would reduce tibiofemoral and patellofemoral loads more so during decline running than during level running. Basically, we're looking for this interaction between surface stiffness and running mode. And the purpose of this study was to determine the effects of running compliance on knee joint forces during decline and level running. So what did we do? Well, we did biomechanics, runners, force plates, motion capture, V3D, inverse dynamics. We have a knee model that predicts tibiofemoral compression, tibiofemoral shear, and patellofemoral compressive forces, and I will report on these a bit today. So this is a summary of our results, and let me say that here we have ground reaction forces, tibiofemoral forces, and patellofemoral forces in terms of several maximum forces, for example, and rate of force applications. The results are a little mixed, but I will point out our basic outcomes. First, there were a number of interaction effects, and in these interaction effects, we saw that in decline running, there was a substantial and significant effect of running with and without the mat, but in level running, there were not too many effects at all. In decline running, without the mat, forces and rate of force applications were substantially higher. In the middle here, in some cases where there were not interaction effects, there were several instances where the rate of force application in decline running was larger than in level running. I will show a few examples. This is the anterior, posterior, and vertical ground reaction force. Here's the maximum braking force. This is the significant interaction I was referring to. Running in decline, we have without the mat substantially larger braking force and substantially less with the mat. No difference in level and no difference in these variables, in this variable, in the maximum vertical ground reaction force. Here's a bit of a funny result. Here we see the significant interaction effect where there was an effect in the decline running where running without the mat had larger loading in tibiofemoral joint, but in level running, running with the mat had larger loading in tibiofemoral joint. And I like to point out that, yes, I don't know what this means, and sometimes we have no idea what we're doing, but there it is. Here we had the rate of force application, and we saw simply that decline running had larger rate of force application than level. But this is my favorite result in the study. I think this really describes our main outcome. This shows the interaction effect in maximum patellofemoral compression in terms of magnitude and rate of force application. Here is the interaction effect in which, in decline running without the mat, on the harder surface, the force was larger in patellofemoral compression, and with the mat, the force was lower. In level running, there was no difference. And the rate of force application had the same change with decline running. Without the mat, the rate was very high and higher than with the mat, and no change in level running. So we conclude by saying we hypothesize that running on a more compliant versus stiffer surface would reduce tibiofemoral and patellofemoral loads, more so during decline running than during level. And the data I have here partially, but I think fairly well supported our hypothesis that the mat proved more effective in reducing the overall magnitude of forces experienced in the knee in decline versus level running. And perhaps this reduction in forces may be helpful in preventing some overuse injuries in runners. Thank you. I apologize for my difficulties.
All right, thank you, Paul. Now we will invite our last speaker, Keaton Sherparil from Georgia Tech. Keaton, you can queue up your slides. Great, and so Keaton, the title of his talk is Estimating Knee Joint Load with Joint Acoustic Emissions During Walking. Go ahead, Keaton.
Awesome. Well, thank you for that introduction. So imagine you're walking down the street and someone drops a grand piano on your knee. Well, that gives you a mental picture of what happens because, as we've been talking about, the peak joint load during level ground walking is around 2,000 newtons, or at least that's what we think, but we don't know for sure because joint load can't easily be measured outside the laboratory. So it could be as high as 5,000 newtons or even as low as 1,300 newtons. My name is Keaton Chaparral, and I want to talk about how we can potentially overcome this challenge using the unique sensing modality of joint acoustic emissions, or in colloquial terms, joint sounds. I want to show that joint sounds contain information about loading that can be used to form an estimate of joint load during walking, opening the possibility for estimating this metric outside of the lab. But first, why should you even care about this? Well, quantification of joint load, or more specifically, tibiofemoral contact force, is very useful in several key applications, including evaluating the progression of diseases like osteoarthritis, predicting the risk of injuries like ACL tears, evaluating rehabilitation approaches, and even designing new devices that can respond to the physiological state of the user. The gist being that actually measuring joint load could inform strategies to improve mobility and quality of life for people across ages and activity levels. But there's a problem. We can't measure joint load non-invasively in vivo, and our estimates can only be performed with special equipment within the lab. So what can we do? Well, this is where joint sounds offer a new solution, a possibility to get at this measurement of joint load. So joint sounds are produced when articulating surfaces within the joint rub against each other, and these sounds propagate through the joint space to the skin where they can be measured with contact microphones. We hypothesized that an increase in these joint contact forces results in a corresponding change in the sounds due to the proportional increase in dynamic friction with normal force, thus allowing us to predict joint load. So previous work has shown that these sounds do indeed correlate with external mechanical load on the knee in controlled environments and narrowly defined movements. But the question still remains whether this translates to internal forces and more complex tasks. So how can we test this? So our protocol involved 11 able-bodied subjects walking under varying speed, incline, and loading conditions, while joint sounds and essential gait measures were collected. The biomechanics measurements were then synthesized using a neuromuscular model to form what we call the gold standard estimate of these joint contact forces. Now, the joint sounds were also processed, and then features, which are specific properties of the sound signal, were extracted from the stance phase of each gait cycle. Finally, given these features and the corresponding average joint contact force for each gait cycle, a subject-specific machine learning model was applied to learn the connection between the features and the joint load. The partitioning of the data for the machine learner was based on two main questions. So method 2 addresses the question of whether the joint sounds, at a minimum, allow us to distinguish between the different loading conditions. Thus, the data was partitioned by reserving a portion of each condition for testing and using the rest for training. Method 1 addresses the further and more important question of whether the differences in joint sound are consistent enough to make a prediction in a unique case. Thus, the data was partitioned to leave a condition completely out in training and then let the model make a prediction of that load during testing. These two methods were then compared to the best baseline estimate without joint sounds, which is the subject's average joint contact force. So these three methods are compared in this results figure where the bars represent the error between the prediction method and this gold standard joint load. So as compared to the baseline prediction without the joint sounds, not only do the joint sounds contain enough information that they can effectively distinguish between the different loading conditions through method 2, but more importantly, they can be used to create a better estimate of an unseen condition through method 1. This confirms our hypothesis that joint load and joint sounds exhibit a correlation that can be used to estimate joint load accessibly and non-invasively. This opens the possibility, hopefully, for clinicians to access a wearable means of monitoring joint load outside the research facility, and for device designers to develop new control strategies and evaluate the effects of rehabilitation toward the end of improving people's quality of life. So remember, when joint load is too hard to measure while walking outside just for leisure, turn to the sound from joints to be found and your estimates bound to be better. Thanks for taking the time to listen.
Great. I think we'll move to some questions. We'll start with a question for Scott from Dr. Friedley. Very nice combined computational experimental study. How do you think your initial and final knee contact force estimates would change if you used a full EMG-driven model to predict muscle activations rather than some flavor of static optimization?
Yeah, that's a great question. I think flavors of that question showed up elsewhere. We didn't calibrate any of the muscle tendon parameters or do a full EMG-informed simulation. And I would expect, it's been shown that static optimization tends to slightly overpredict the peak contact forces. So I would expect that our peak contact forces at baseline might come down some, but static optimization is generally sensitive to changes in joint loading from a gait modification validated in an instrumented knee. So our changes in muscle activation were fairly large, and the muscles we didn't constrain, so everything but the gastroc and soleus, all of the activation changes in the simulation generally matched the changes we saw in EMG. So I would expect magnitude changes, but I think our directionality probably wouldn't change.
Another question for Scott, and we make sure you all can hear me.
Yep.
Another question for Scott. Given increased soleus forces, have you inspected ankle contact forces for increases in terms of shear and compression? If so, are any increases at the ankle equal to decreases at the knee? This is from Adam Yoder.
Yeah, it's a good general question. You know, if we target just knee contact force and change our muscle activations, what are we doing at the ankle and knee? I don't expect, so the net ankle moment didn't change in the experiment, and the moment arms of the gastroc and soleus, I mean, it's the same tendon. So I don't expect large changes in contact force at the ankle. At the hip, had people adopted the coordination strategy that the initial simulation suggested, it increased co-contraction quite a bit about the hip. So increasing the hamstring force required quite a bit more iliacus force. So joint contact force would have gone up at the hip. But it turns out people didn't actually increase their hamstring force in the experiment as the initial simulation suggested. But it's a good thing to pay attention to as we move forward clinically.
Next question is for Dan. This is again from Dr. Friedley. He said, interesting study. When I think about step length effect on knee contact force for symmetric walking, I would expect shorter step lengths to produce lower knee contact force. However, in your study with step length asymmetry, the leg with the shorter step length had a higher knee contact force. Do you have any thoughts on this seeming inconsistency?
Yeah, that's a great question. I'm kind of thinking about the literature when it comes to those with lower limb amputation who have a unilateral propulsive deficit. And you found that the unilateral propulsive deficit may lead to a shorter step length on the attack limb and also increase collisional forces in that same limb. So I kind of will equate those together, that we haven't exactly looked into the differences in the collisional forces and all, but that might increase the force on the limb. Also, we did the whole stance phase peak, so there might be, especially during that post-adaptation phase, that gastrocnemius for that limb is going to be slightly more active than the other side, which may contribute to that peak.
I had a related question since we're on that topic, but have you looked at step timing? So I imagine, so you also have an asymmetry in step timing during that post-adaptation period. Might that
correct
also affect that association?
Yes, it does. And especially we examined during the adaptation condition as well to look at that. And that's where step timing primarily had the effect. But the step length seemed to be much more effect during the baseline and post-adaptation condition. But step time and stance time asymmetry does seem to have a significant correlation with both the impulses and the peak joint contact forces.
Another question from Jinhao Wang. With a decrease in, this is for, Stan. Yep, one more question for Scott, actually. With the reduction in gastrocnemius activation with compensation by increased soleus activation, does this increase other joint forces and potentially pose, a risk of injury or long-term degeneration in other joints?
Yeah, I think I partially answered this with the last question. There's a possibility that people, by changing the activation of biarticular muscles, they'll be co-contracting in other joints, and we should pay attention to that.
All right, next we have some questions for Paul. There were several questions along this vein, so I'm going to start with the first one from Wooter. He said, do you have any more details about the mechanical properties of the mat? Someone also asked about the damping of the mat. And do you control for footwear? And have you considered looking at the effect of the mat for barefoot running?
We do not control for footwear. We do allow everyone to wear their own shoes that they have been wearing. We inspect the shoes. The shoes seem to be in good condition, but they are wearing different shoes. We have had some trouble converting the specifications of the mat, which I show a sample of here, which in the industrial literature, the stiffness is expressed in Shear, and we of course like stiffness in displacement and force. And so I have not been able to convert the Shear measurement to our regular stiffness measurement. It's actually very difficult to find out. And Wouter, I would love if you could help me with that, okay? And what was the other question? There was a third question.
Sorry, it was about the mat itself and the damping of the mat.
Well, I think that's related. We do not have the specifications exactly other than the Shear value. We have actually done some testing where we have dropped substantial weights onto the force plate itself and the mat itself, or the mat on the force plate, and there was large and substantial damping effects of that. That's about what I have on that.
Another question for Paul, and I think this is just a great general question for all of us analyzing data across subjects. So when looking at your data within subject, did all of your individual participants demonstrate the group findings? This is from Jill Gray from USC.
The results actually were quite consistent within subject. I did look at that because you may have noticed some of the mean differences were not that different. So some of the significant effects statistically were only 3 or 4% different. So we did go back to see and to check that, in fact, there was a consistent effect across the individuals. That's how we got the significant statistical effects, although the means were not that different.
All right, let's move on to a question for Keaton. Are there concerns about the sounds from other structures like ligaments, soft tissue, or other bones? Or do those additional effects are they handled by the machine learning?
Yeah, that's a great question. So there's a couple things with that. One, so hopefully looking at specific like frequency bands, we're looking only at like 100 to 1,000 hertz. So that's kind of lower frequency side of the sound signal. And the idea from previous literature is that is kind of where these grinding sounds are contained that kind of indicate this dynamic friction within the joint. But yes, other noises could interfere. So hopefully that, as well as obviously the machine learning model, will hopefully take care of some of that if there is additional noise from other sources.
And our last question, let me open the chat. Yeah, so this question was also for Keaton. How would you propose to do the translation of your analyses to actual force? So I think this is a question about validation here.
I'm not sure I entirely understand the question, but as far as so the machine learning model will give a prediction for the force over that stance phase, kind of the average joint contact force for that stance phase. And so as far as the translation, really we're looking right now at the machine learning model, which can take in these different features that we pull out from the joint sounds, and then that's what translates it into this prediction of the joint contact force for each gait cycle. I hope that answered the question. I'm not.
And if Christy, so Christy posed this question, if she's still here and would like to clarify, feel free. Okay, so with that, I think we are just at time, a few minutes over here, but I'd like to thank all of the presenters for staying on time and giving excellent talks. And I'd also like to thank the other moderators. This was an interesting challenge, balancing virtual talks with a chat and a Slack channel. So yep, we'll continue this discussion currently on spatial chat, and we're translating questions from the Zoom chat to Slack. So try to kind of stay engaged here and continue the conversations. All right, thank you. We'll end the session now.